Hi, Anteaters. My name is Yuanhong Huang, and I'm a psychology intern at the Counseling Center for the 2020 to 2021 academic year. In this video, I'm going to talk about microaggression, which many of you may have experienced because of biases towards your nationality, ethnicity, skin color, body image, gender, sexual orientation, or disability. If you want to learn more about microaggression and how to respond to it, this video might be helpful. So, what is microaggression? Microaggressions are subtle daily verbal and nonverbal exchanges, whether intentional or unintentional, that communicate hostile, derogatory attitude and discrimination towards people of marginalized groups. There are three types of microaggressions: micro-insults, micro-assaults, and micro-invalidations. Micro-insults are behaviors, actions, and verbal communications that are rude, insensitive, and are humiliating to a person's racial heritage or other identities. They may be subtle snubs that convey a hurtful message. They are often based on conscious or unconscious group stereotypes. Perpetrators of micro-insults may not always be aware that their comments and behaviors are hurtful. Here are a few examples of micro-insults, but these are not all inclusive. You may feel offended when being asked, "Do you eat rice, dog, fried chicken, pho all the time?" And your frustration is totally valid. When people make assumption of you and your background, it could be a form of microaggression. "You're pretty for a Black, Asian, Middle Eastern girl." It sounds like a compliment, but you may feel very uncomfortable when people say that to you. Why? These comments are indicative of implicit biases towards the beauty and desirability of other races. It implies that girls from your ethnic background are typically unattractive. "You're Latina, so you should do the cooking and babysitting." This is very derogatory. This conveys the message that Latinas are mainly good at domestic skills and not other value skills, such as leadership skills and organization skills, which is not true at all. Microassaults are conscious and deliberate discriminations that are usually more overt than microinsults. They can be verbal, nonverbal, and environmental. An example of verbal microassaults is name-calling using racial and sexist slurs. Nonverbal microassaults can include different types of behavioral discriminations. For example, international students often feel excluded from the social interactions of their peers who reference American cultural knowledge, such as television shows or using slangs. Environmental microassaults include offensive signs, posters, or other visual displays that have explicit discriminatory messages. An example of this would be posters that objectify women. Micro-invalidations are comments and actions that ignore or dismiss the thoughts, feelings, or experiences of a person that experiences marginalization. For example, after seeing the posters that objectify women on campus, you approach your professor and express the concern. It would be a micro-invalidation for them to say, "Don't be so sensitive, it's just a humorous expression." Or after telling a friend that someone yelled at you because of where you're from, your friend says, "You must have done something wrong for that to happen to you." That is also micro-invalidation. Research shows that repetitive experiences of microaggression increase the risk of developing clinical symptoms of anxiety disorders, depression, and post-traumatic stress disorders. Victims of microaggressions may also experience a sense of being invisible. They may feel that their unique characteristics and identities are not truly acknowledged when they are seen only as fitting others' preconceived stereotypes or as being extraordinary exceptions to stereotypes. A campus that has a microaggressive environment can make some students feel invalidated and excluded. If a person perceives that others may view them as inferior, an outsider, or any other stereotypes, it's possible that she or he may internalize these impressions and have a negative view about themselves. They may experience a sense of inadequacy, lacking confidence, and sense of worthlessness. People may have ruminations of what other people have said, which is a poor use of time and energy. A person may also lose their motivation in a microaggressive environment, which may impact their academic functioning, creating more stress. As you can see, because microaggressions are subtle and sometimes the perpetrators may do it without awareness or intention, people may find the microaggressive acts ambiguous, feeling uncertain about the nature of the situation. This can lead people to overlook the harmful acts or words. Even when the recipient of the microaggressive acts felt uncomfortable and hurt, they may dismiss what happened and blame themselves as overly sensitive to the encounter. This could further marginalize the person who experiences the microaggression. If you experience a microaggression, you may follow 3 steps to decide how you will react to the situation. The first step is to decide whether a microaggression really occurred. If you are certain that a microaggression did occur, the next step is to evaluate the potential outcome of responding or not responding. The third step, if you decided to respond, is to think about how you would like to react. Let's go into more details about these 3 steps. Some microaggressions can be very obvious that a person can identify them without effort. With some encounters that are more subtle, a person may question whether a microaggression really happened. In situations that are ambiguous, it may be helpful to paraphrase and check with the person to make sure what you heard is what they said. For example, you can say, "I think what you said was this. Was that correct?" You can also ask them to help you understand what they meant, such as asking, "Could you help me understand what you meant by that?" When there are people around, particularly people who you can trust, verifying with them and having them validate the microaggression will make it easier for you to label what happened as a microaggression with more certainty. When there is no one around, it may be helpful to seek support from loved ones. You can call, text, or communicate with their social media networks about what happened to gain their perspectives and support. When you're pondering whether you should respond to the microaggression or not, it may be helpful to ask yourself the following questions. If I respond, could my physical safety be in danger? If I respond, will the person become defensive and will this lead to an argument? If I respond, how will this affect my relationship with this person? For example, coworker, family member, classmate, and so on. If I don't respond, will I regret not saying something? If I don't respond, does that convey that I accept the behavior or statement? If you decide to do something to respond to the microaggression, here are a few tips that might be helpful for having these conversations. First of all, the way you respond can take many forms. You can do it in a passive-aggressive way by rolling your eyes, staying silent, or making a sarcastic comment to communicate that you're annoyed. You may also react by yelling back when it's safe. This can be a therapeutic way of releasing accumulated anger and frustration. If you have more energy, reacting in an assertive way may be a good idea. This includes calmly letting the perpetrator know how their act has made you feel. It will be helpful to separate the intent from the impact and express your feelings using I statements. For example, You can say, I know you didn't intend this, but when you said this and this, I felt such way because the underlying message of what you said is such, and such. It also may be important to adjust the behavior and not the perpetrator. What this means is that instead of calling the perpetrator a racist, it might be best to say that the behavior he or she engaged in was racially charged and offensive. Remember, you don't have to deal with the impact of microaggression all by yourself. It's always helpful to seek support from loved ones and from us. Counseling Center is here to support you. We offer time-limited individual therapy, one-session visit, initial assessment, referral, therapy groups, workshops, urgent care, and consultation. Our services are confidential, and there is no additional fee to currently register students. To learn more about our services, service offerings, and resources, you can call our front office at 949-824-6457 or go to our website at counseling.uci.edu. Thank you for watching the video. Best of luck. Go Anteaters!